I'm Juno Roche and I'm part of a group which is called the Expert Advisory Group on Trans Research. Rusi and Shima are currently conducting some research looking at the experiences of trans women living with HIV. Both of them in their own fields really are experts and are leading the way. Shima in relation to women living with HIV and Rusi in relation to gay men living with HIV and looking at PrEP and a number of other issues. Thinking about the work that you're both doing as cis academics, can you just say what draws you to do the work that you're currently doing? So why us? Why the trans community?
The key is to make sure that when you are from outside the community that you're working in partnership at all levels to make sure that the research is meaningful.
I think it's really important that we do actually work together towards a common aim of improving well-being among people living with HIV.
I'm a cis woman, but I am also a woman in a predominantly male society, and I'm from a minority ethnic group, so I may not have understanding of being trans, but I have understanding of being from other marginalised communities.
A lot of trans people are asked to take part in research, and actually it just ends up feeling like lip service. What can this research do to improve things for the trans community in relation to their healthcare?
Our research has uncovered some of the challenges that might be specific to this group that can enable us, for example, to inform policy and practice in the area of healthcare, to improve outcomes. So the research really does need to inform policy and practice, and that's what we're aiming to do.
There's virtually no research on the needs of men and women in the trans community when it comes to both preventing HIV but also living with HIV as well. Now, speaking as a doctor, it's really important that we understand what good care and what good prevention may look like. But to be able to get to that point, you need to do the research.
One of the things that struck me when I conducted the interviews was that the vast majority of participants had tested for the first time and the test had been positive, and that when they were diagnosed very, very late. Our research can enable us to begin to understand some of the reasons why people may not be testing very frequently, and also to understand why people are being diagnosed so late.
We still don't really understand how men and women in the trans community want to access PrEP, whether there are any barriers to it, what could make it easier for people from this community to access PrEP. So actually some of the research that Rusi and I are planning to do may actually uncover some of these things and can help us make sure that in my clinic that we tailor our services so that they're really friendly to people from trans communities.
What would you say to trans women out there who you want to take part in your research about why they should trust you?
The work that I've done before has, as I said, predominantly been, or mainly been with cisgendered women living with HIV, but all the work that I've done has been in partnership with communities, and I've spent 10 years building up trust within that community.
I developed this research project in collaboration with Shima because I felt it was very important that we actually do communicate the voices of trans people so that we can make improvements to healthcare. And I think by participating in this research, that's a real opportunity to make a difference. There are a number of ways in which people can express interest in our study. You can email us on the email addresses that are displayed, or call us, and even on social media we're available on Twitter and also on Facebook.
I know it's a big leap sometimes to talk to strangers. I don't think we're too scary, hopefully, but we can't do this without you. It's only through talking to you and working together that we'll actually be able to make real change. So yeah, just talk to us.